Hi guys, welcome back to this channel and thank you so much for clicking on this video. I am excited to have you back on board, especially all my returning subscribers. Thank you so much for coming back to watch more videos. I really appreciate you all. If you're new to this channel, my name is Ini and you are watching the Newness Space. Thank you so much for clicking on this video. I really appreciate your presence here. Also, I hope you had a lovely weekend and this week is starting on so well for you. So today we're going to be talking about fever in babies. So stay tuned and let's talk about this topic. So let's talk about fever. Fever is just the body's way of fighting infection and illness. And anyone can have fever, as in adults, babies, anyone can have fever. But today we're going to be talking about fever in babies. What are the common causes of fever in babies? The first one I would like to mention is vaccination. Yes. You probably be told, as a parent, you probably be told if a baby is having the KEPI vaccination, mostly known as a government vaccination, there is a very high chances of them having fever. But if you're giving your baby the baby-friendly vaccination, the chances of getting fever after the vaccination is very, very low. Yeah, so it's called post-vaccination fever reaction. Yeah, but I don't know if that is true or not, but I'm gonna tell you based on my experience. For us, when we got our baby, they gave us the two options: KEPI vaccination or baby friendly vaccination. Now, if you have studied these two vaccinations, you discover that the baby friendly vaccination is very expensive. So we looked at it and we looked at the cost and we are like, we don't have the financial muscle at the moment to accommodate baby friendly vaccination. So we just said we'll go with the KEPI vaccination, and we prayed to God that our baby would not react to it. So by the way, my baby has been on the KEPI vaccination and she has never had fever after vaccination, and I really thank God for that. So whether the theory of saying that if the baby does KEPI vaccination, they will have fever, or if they do baby friendly, they won't have fever. I don't know whether the theory is true or not, but my baby did not have fever after vaccination, and we did the KEPI vaccination. Yeah, I also know of a mother who took the baby through baby friendly vaccination, and the baby reacted after the vaccination. The baby had serious fever. So again, I don't know. I think babies react to these things differently. You just need to trust God that your baby will not get fever after the vaccination, and just go with what your pocket allows you. Yeah, because they react to it differently. So there is that fever that can come after vaccination, and again I say it reacts differently to babies. Then the second causes of fever probably in babies is baby when they are not feeling well, they're sick, or their body is just fighting some infection. It could be viral infection, bacterial infection, whatever infection they are fighting, it can come out in form of fever. All right, so now after having put out the main foundation of fever and what could cause possible fever in babies, I want us to talk about how should you react once you've discovered the baby has a fever. How do you react to it? So some of the tips on how to react if you suspect your baby has a fever. The first thing I would advise you to do is to ensure you check their temperature. And for you to do that, you need a thermometer. The one I have looks like this, but there are different types that you can get depending on your preference. Yeah, so you check the temperature of the baby either under their armpit, of course not on the clothes, but directly on the skin, or the anal way of checking it, or through the ears. Most hospitals would just put something in the baby's ear and to check the temperature, or even through the mouth. Yeah, once you've checked and you've discovered that the temperature is 37.5 degree and above, it means the baby probably has fever. So the second thing you need to do is to call a pediatrician or a doctor. Yeah, if you call a pediatrician, there are some things that they would likely tell you. The first thing would be remove some of the clothing on the baby. Yeah, leave the baby with very few clothing, like most likely just the onesie. Yeah, because if you cover the baby so much, it will increase the fever. But if you remove some layers of clothes on the baby, it will help reduce the fever. So that's one of the first things you'll be told to do. The second thing most likely you'll be told to Take a face towel, dip it in a lukewarm water, and place it on the forehead of the baby. It helps to reduce the pressure and to bring the fever a little bit down. The third thing most likely you'll be told to do is to give the baby paracetamol. Yeah. Now talking to give the baby paracetamol just to help subdue the fever. The fourth thing you'll be told, if the fever is so high, like 39 degree, 40 degree, you'll be told to come to the hospital or to the clinic with the baby for proper medical checkup. All right. Now, speaking of paracetamol, the main reason why I'm doing this video. Now, the paracetamol we have looks like this. This is the most commonly recommended paracetamol for babies. It looks actually like this. Yeah, and I think it's also a must-have. Just have it around the house just in case on those different season that the baby probably has a fever. Now, the bottle actually just looks like basically like this. So you'll be told to give your baby paracetamol, and if you look at the packaging, it has the recommended quantity of of the medication you should give to your baby depending on their age, the age of the baby. Okay, so if the baby is 3 to 6 months old, you'll be told to give 2.5 ml, which, and the spoon that comes with it looks like this. This small one is 2.5 ml and this one is 5 ml. Some hospital would either tell you to go with the spoon or with this. And if you look at it very well, it just has some numbering in terms of ml. So you can also use this if you feel like your baby will resist the spoon. You use this as well. You give the baby paracetamol and it will help to subdue the fever. But if it is so high and really disturbing with other strange symptoms, you need to take the baby to the hospital. So the main reason why I did this video is just to bring out the fact that babies can have fever. So if you discover your baby has a fever, do not panic. Just follow some of these steps. Remove some layers of clothes on the baby. Take a face towel, dip it in lukewarm water and place it on the forehead of the baby. Let the baby have good rest and enough fluid. Let them have enough fluid, water, juice or yogurt or something, enough fluid that can keep them hydrated. Let them rest as much as they can. Yeah, it will also help to calm them down. Yeah, you give them paracetamol, remove some layers of clothes. But if it is too high and with some strange symptoms as well that follows it, please ensure you go to the hospital. Let the doctor check the baby out. So do not freak out, do not panic. Fevers can, and babies can have fever. Okay, so do not think your baby is dying. Thank you so much for watching. I am grateful. I'll see you in my next video. Please do not forget to give this video a thumbs up if you liked it. Comment also on this video, share it, and remember to subscribe if you have not yet done so. Turn on the notification bell if you've not yet done so as well, so that you can get more videos from me. Whenever I post a new video, you'll be alerted.